Hello, this is Dr. Kim Jung-il. We are going to cover the topic how to finish the malocclusion. This will be the first part, introduction. In particular, in the case where the premolar is extracted, it is best to close the extraction space and remove the appliance. However, this is very rare. It may be one case out of 100 cases. That is why many orthodontic treatments require a process called finishing. In this finishing stage, individual tooth movement may be necessary, or skeleton improvement is also required to resolve the relationships between anterior and posterior relationship and vertical relationship. This finishing process will be applied not only to the premolar extraction cases, but also to the non-extraction cases. In the finishing stage, it is very important to predict teeth movement and how it will be going. The treatment for this patient was over in 2011. This is a case where treatment was completed by me and associate doctor in our hospital. When the treatment was over, the occlusion was good on data. It has a Class 1 canine relationship, a Class 1 molar relationship, midline match, and an appropriate overbite and overjet. However, 3 years later, he complained of discomfort in the temporomandibular joint and the maxillary anterior region. What is the occlusion like? There is open bite tendency in the premolar and molar region. Why did this happen? This is the panorama photo in post-retention state. Even after closing the extraction space, the mesially inclined teeth were not uprighted. Even after treatment is over, it is highly likely to be more inclined like this. In particular, the mesially inclined maxillary teeth should be uprighted. This patient is a case where another hospital asked me to remove the appliance. No appliance was attached to the second molars. The extraction space has been closed by using a closed coil spring from the maxillary hook to tooth 6. And the space has been closed by using an energy chain in the maxillary anterior part. Should we remove the appliance or not? We need deep consideration. The canine relationship is Class 1, and the molar relationship is also Class 1. These are Ceph and the panorama views of this patient. The mesially inclined mandibular second molar was not uprighted because the appliance was not attached to the tooth 7. What will happen? As wisdom teeth erupt, it is highly likely for the mandibular second molar to be inclined mesially, so the appliance should be extended to tooth 7. This patient was also transferred while being treated at another hospital. There is mandibular anterior crowding, both canine and molar relationships are good. The profile isn't bad either. However, the appliance is not attached to the second molars and only the anterior part was aligned. The teeth are well aligned and good. But what is the mandibular second molar like? Like this, the mesially rotated mandibular second molar is shown. It would be the same in the maxilla by attaching the appliance to the tooth 7. Since the appliance was not attached to tooth 7 in the maxilla, the arrangement of the original arch form itself does not change. In this patient's case, if strategic leveling and alignment is made, the mesially rotated mandibular second molar can be easily aligned and placed in the right position. The mesially rotated and inclined teeth like these should be uprighted by attaching the appliance to the second molar. In other cases, the midline is slightly deviated after closing the extraction space. Like this, the center is slightly deviated. When you treat the patients, you should keep that in your mind. In this case, we should consider not only aligning the occlusion, but also checking the midline. While closing the extraction space, The molar can be mesially inclined like A or uprighted like B. At this time, the best case is that the extraction space is closed while the molar is uprighted like B. However, when the extraction space is closed, the anterior crowding should be resolved. The maxillary incisors should be aligned in the proper position, and then the posterior teeth should be moved forward. At this time, the movement speed of the left and right teeth is not always the same. Then, what will happen? Asymmetry occurs in the occlusal plane. When an asymmetry occurs in these occlusal planes, the mandible is deviated laterally, and the midline is deviated. If the midline is deviated like this, the occlusal plane, torque, and so on, all change. So to finish orthodontic treatment, these problems should be resolved first. And it usually takes a long time to resolve these. The preferable tooth movement pattern in the finishing stage should be controlled in 3 dimensions. So, first-order bends, second-order bends, third-order bends. What are first-order bends? It is a tooth movement to an ideal arch form. For second-order bends, the mesially inclined posterior teeth should be uprighted. In particular, the mandibular molars should be uprighted. Third-order bends means torque, the left and right torque should be balanced. First-order bends are an ideal arch. In the second-order bends, the curve of Spee should be controlled. In the third-order bends, the left and right curve of Wilson should be controlled. We should figure out the connection between the various malocclusions and first-order bends, second-order bends, and third-order bends. And it is necessary to resolve these problems in the finishing stage. Because finishing is difficult, many use a variety of wires. In the book, Orthodontic Concepts and Strategies written by van der Linden, loop, tloop, and various loops were applied. Shirashu in Japan used an arch wire called GEAW, modified GUM metal arch wire. What is the desired tooth movement in the finishing stage? In the first case, if there is a deep curve of Spee, it should be leveled. In this case, it means managing the POP. POP stands for Vertical Dimension Management. It must also allow individual tooth movement. Not only this, but also en masse movement as a whole should be allowed. It would cause preferable tooth movement in the finishing stage. In particular, it is important to flatten the deep curve of Spee and the POP. This type of tooth movement can cause the mesial inclination of teeth after closing the extraction space. In this case, the mandibular teeth and the maxillary molars should be uprighted. For this, many orthodontists would use a curve of Spee type arch wire in the maxilla and reverse curve of Spee type arch wire in the mandible. Ready-made wire also can be used. However, MEAW uses a MEAW with a tip back bend as loop is applied. The desired tooth movement can be obtained by applying the curve of Spee for the maxilla and the reverse curve of Spee for the mandible. In general, there are various types of arch wires used in finishing stage. The default arch wire is ideal arch wire with tip back bends. The second is a nitty arch wire with a reverse curve of Spee. Next is the MEAW wire with tip back bends. The detailed tooth movement here will be mentioned again later. What we need to know here is how to finish with MEAW. And what we want is to know what the tooth movement pattern would be. In this case, it was based on a paper on MEAW. These papers about MEAW were widely published in Korea and Japan in the late 1990s and early 2000s. Another thing we need to look into in detail is the properties of the vertical and horizontal components that the loop has and is LDR, load deflection rate, of MEAW. Next, we need to know about the three-dimensional tooth movement pattern. In the meantime, we have to study how teeth move when MEAW and various elastics are used. If necessary, we also need to study how to adjust these meals. First, we need to know how teeth move by dividing the maxilla and mandible into incisors, molars, and premolars. Viewed from the front, if a tooth is moved forward, it is called labioversion. And if it is moved backwards, it is called linguoversion. Next is intrusion and extrusion. However, in many cases with class 3, intrusion and labioversion is needed, and in some cases, the extrusion and labioversion is needed. We need to know the desired tooth movement pattern, and we need to study how teeth are moved during the finishing process. This is the same in the posterior teeth. In this way, it is the principle that the mesial movement, distal movement, and intrusion cause the mesial movement. In particular, in the class 3 malocclusion, such tooth movement should occur. On the other hand, in class 2, distal tipping, that tooth moves backwards and intrudes, should occur. In some cases, extrusion can cause uprighting and movement to the mesial. This can vary depending on the various patterns of malocclusion. The same things happen in the mandible. We should check what tooth movement patterns we want from the incisors, premolars, and molars. And we should also check that the tooth movement occurs like this in the mandible in the finishing stage. If such tooth movement occurs as expected, the finishing will be easier. In the case without the elastics, there are various cases, such as maxillary central incisors, maxillary premolars, maxillary molars, mandibular incisors, mandibular premolars, and mandibular molars. We should know the tooth movement patterns for each case without elastics and with anterior vertical elastics, short class 2 elastics, and AVE together. Then, this pattern of tooth movement should be related to the etiologic factors of each malocclusion that we think of, namely class 2, class 3, class 1, midline deviation, deep bite and open bite. We can obtain desirable results only if the direction of the treatment to solve etiologic factors and the tooth movement in the finishing process must be almost identical. In this concluding chapter, we will focus on these things and study together. Thank you for watching.